Tania Dufty, so I'm the Director of Strategy for the Australian College of Nursing, and I set up the Mid-Career Nurse Leadership Program for ACN. At the Australian College of Nursing, we realised there was a gap in how we were developing our mid-career nurse leaders, a professional gap. So we established the Mid-Career Nurse Leadership Program to give mid-career nurses, who are generally 6 or more years in the profession, the opportunity to engage with high-profile nurses across Australia, and these are nationally and internationally renowned nurses. So giving them the access to have discussions and learn from our professional nurse leaders. It launched in June this year, and participants had 5 days of a face-to-face workshop with high-profile nurse leaders, and that is now followed by coaching, one-on-one coaching for 6 months, along with learning sets, participation in learning sets, and to complete an initiative or a project in their workplace. We have 22 participants in the Mid-Career Nurse Leadership Program. They're from right across Australia, working in the public system and the private system, in acute, aged care, and in primary health care. So we've managed to get a cohort that covers all sectors.
My name's Darren Mitford. I'm the Nurse Manager of Camden and Campbelltown Emergency Departments, which is in Sydney South West Local Health District, New South Wales. I've been a registered nurse for the last 11 years, and I heard about the mid-career program through my district don, who encouraged me to apply. The course itself has professionally grown me by giving me practical tools to build my capabilities and progress my career into the future. Personally, it's encouraged me to self-reflect and personally grow into my professional career. The networking that was involved from people very like-minded to myself from across the state has been fantastic, and the calibre of people that taught us come from across Australia, have internationally recognised professional capabilities, and their logic and their teachings has been very valuable to me personally.
The participants had access to the high-profile nurse leaders from across the country. They engaged with those high-profile nurse leaders, and it was a very interactive session through those 5 days. They were amazing how watching them grow and learn, and just the way that they engaged and wanted to develop over that period of time, and then hearing their feedback now that they're a couple of months out from the five-day workshop. It's just amazing the way that they've taken on what they learned in that 5 days and then taken it back to their workplace and made change, whether it's been personal growth, whether it's the way that they've developed their teams or the projects that they've worked on. It's an absolute pleasure to watch, and very proud of all of them.
I'm a clinical nurse consultant in Metro South Health. For the last 18 months I've been working in quite a challenging personal growth position within my healthcare organisation, and learning a lot about the way that the organisation works, but also learning more about kind of where I want to go in my career. I hadn't really been too affiliated with the Australian College, or didn't really understand the opportunities that they provided until I received an email about the Mid-Career Nurse Leadership Program. I thought at that point that would be a really good opportunity for me to explore where I could grow in my profession, and also explore where I could learn from some of our greatest nursing leaders across the country, to be able to self-develop and self-evaluate where my career might be heading based on their experiences. So I jumped in and applied for the program, and was luckily successful. I have found it such a great opportunity to not only understand nursing from a national perspective, but also really gain insight from everybody's experiences, and the calibre of the teachers and the leaders that we had exposure to. You would never get that in any other program, and I think that's just been an extremely valuable and rewarding experience for me.
The impact that these 22 participants will have is that they now have a really good understanding of the issues that our profession face, and they have had access to high-profile nurse leaders from across the country and learnt from them or understood from them the challenges that they face as well. So they're able to take what they learned in the workshop back to their workplace to change culture, change teams, but also understand professional issues such as how you might staff a ward, and how the staffing a ward will have an impact on the actual patient outcomes on that ward. also about how nurses can engage in the organisation to lead change and make change. So how do they engage and network with the CEO, the nurse leaders within their organisation or people outside the nursing profession to really drive change in the organisation and make a difference for patients.
It makes me really excited to see where nursing is going. For me, I love patient interaction and patient clinical care, but I also love the leadership side and the nursing leadership opportunities. So I think for the Australian College to provide an opportunity for us as national, nationally regarded nurses and the national health service systems that that encourage these nurse leaders to grow. I think it's giving us a fantastic opportunity to help take nursing to that next level and help drive forward some of those policies and some of that those skills that nurses don't necessarily think that they have or think that they should have as a nurse, and bring them forward into the next generation and be able to provide that support and that mentorship and that self-growth for nurses all over the country.